this IoT content with 3 speakers that are going to talk about health, spirit, and body. And somehow there is a guiding thread to that. Johannes? So let's talk about health. Hi.
Thank you for sharing lifetime here together in Istanbul in 2015. Our world is getting mobile. We want to have a mobility solution. We take out our mobile phone and we open the car with our mobile phone. We sit in there, drive, and just leave the car. The same principle applies to bicycles. If we are looking for the best restaurant around us, we take out our smartphone and it guides us there. Arriving at an airport, we have an app that shows the ticket and we interact with our surrounding. Also, in some countries, we start to pay with our smart devices. So the world around us is getting more and more mobile enabled. And we're getting used to having access to everything at every time. All the examples I gave you were about interaction with our surroundings. So we transfer data locally, we gather data with our smartphones, we authorize ourselves and authorize digital transaction. Smart devices know about their surroundings, they know about their context. For example, my calendar switched the time. My smartphone knows that I'm standing right now and not walking, cycling, or driving. So smart devices know their context. We also start to interact with chips, codes, and so on. It all comes together in smartphones, and that is now and not the future anymore. The most valuable apps we have today are context-sensitive apps and app ecosystems. I am a doctor, and let's switch to the medical environment. If you think about your last visit, and in some countries, or most of the countries, at least one of those pictures apply, it is still analog, at least some processes. Imagine you go to the doctor, and what do? First thing, you check boxes. And then your doctor will ask you a question like, when did you take which medication, for how long and why? And you as a patient, you typically don't provide the exact answers to this question. That leaves the doctor in a state of, well, I get a snapshot now, but I don't have the right data. In some countries, data is still exchanged on paper and CD. I mean, CD, come on, that's, I don't know, last century? Over time, and I ask you, who has got their health data with you? Over time, we as patients, we lose our health data. As I told you, I'm a doctor, and let's take a look at the doctor's side. Imagine you're a doctor, you're sitting there with a patient, and you have limited time with this patient. You have more patients, and they're patiently waiting in the waiting room. A nurse, she wants you to sign some documents in between, obviously, because you have to do and manage the things. You have an appointment coming up, for example, with your wife, your husband, or even the management, and you're still there discussing with the patient whether the patient is allergic to amoxicillin or any antibiotics. And this is archaic. Doctors have access to technology. It is high-tech in medicine right now. We used MRIs, CTs, ECGs, EEGs, and so on. But you as a patient, you're not connected to this world. On the other hand, we as a patients, we use amazing technology, smart devices. We use scales, we use Bluetooth devices, and so on, and the doctors are not connected. Let's analyze from a bird's eye view. We have an ecosystem. We patients have an ecosystem. We use smart devices like Apple Watch health devices. We use apps, Runtastic and so on to track our health. We use a scale to step on and it dumps the data in our smartphone. We use platforms, Apple Health, Google, whatever. And sometimes we still use paper. That is our consumer health ecosystem. It is rapidly growing. On the other hand, the doctor's ecosystem. Doctors use medical devices. Doctors use specific IT solutions. Doctors use high-tech images. It is amazing where we can look at today. Also, doctors use cloud solutions and electronic health records. The question remains, how do you connect those two worlds? My team and I, we're working on a solution. We call it mobile-enabled medicine. Health data transfer or health data exchange between patients and doctors via smartphone. It should be super simple. So how does it work? We have developed a small hardware, this one here. We call it LifeHub. It enables any medical system to communicate with smartphones. Plug and play, system independent. It's for doctors and hospitals. On the other hand, we have an app, we call it Lifetime app. It's an encrypted container for all your health data on your smart device. From there, you decide what you want to share, when you want to share it, to whom you want to share it. The app's on Android and iOS live in Germany right now. Between LifeHub, the small device, and your app, you can locally exchange your data with your doctor. So imagine again, you go to your doctor, and regardless of the system your doctor uses, you just hand over your health data. Not the snapshot in your memory, but just the whole data gathered by all your devices. And your doctor can work. I mean, that's what you're going to him for. And the doctor, whatever he does, a lab result, a new x-ray and so on, he can just give it to you directly on your smartphone, like he would today. Talking about those ecosystems, we connect them by providing a seamless user experience. Let's take a look what our customers say. It is the next generation patient service. I also need a LifeHub for my second practice. That is market demand. And now I would like to share something that made me speechless. We have some of our doctors in the Slack channel. My smartphone doesn't work anymore, so I have to switch. He's called Oliver Starke, and he, as I said, is in our Slack channel. And yesterday, he posted something on the Slack channel. He posted an unboxing experience of a device in the medical field. Have you ever seen that before? But furthermore, he acquired 5 more doctors by himself. I would call this a glimpse into a viral effect. Now let me share 3 hypotheses for the future. First, we need algorithms to cope with data in medicine. Kind of obvious. There's data flooding towards doctors. There's data flooding towards patients. We need to integrate them, but something is happening here. The responsibilities are shifting from patients and doctors to entrepreneurs, investors, and developers. That is dramatic. Also, and we start to seeing this already, we will shift from getting well to staying well. The last centuries, well, actually ever, medicine was about, whoa, I see this kind of disease, so let's treat it like that. The next thing is that before we even know it, we can treat something that will come up based on predictive analytics and so on. And third point, the role of a doctor will dramatically shift in the next years. What I believe is that the doctor will shift towards an advisor. Together with the patient, I as a doctor, I will look at data. I will look at algorithms. And I need to understand software. I, as a doctor, I need to understand all the health data that is created by smart devices. And then together with the doctor, together with the patient, we will decide which algorithm to trust. Going into 10 years, 20 years from now, patient and doctor interaction will not be the same. But we still, as human beings, we still need someone to trust. It is a human person. And I believe that is where we're heading. Analytics, software, human interaction will stay human interaction. Let me wrap up. Health data transfer between patient and doctor via smartphone. And it is super simple nowadays to take your health in your hand. Thank you very much.
Thank you. Any questions from the audience before we switch back to one of the presenters that was there?
Okay, thank you very much.